So Senator Tim Kaine is having some reservations about some of his Democratic colleagues' embrace of Medicare for all, single-payer health care. Now, Tim Kaine was, of course, Hillary Clinton's vice presidential pick during the 2016 election. He was the one that everybody kind of forgot about. I remember making jokes about him being on a milk carton because he was gone. Like, nobody saw him. Nobody noticed him. I kind of forgot he was even there. Why? Because he had the charisma of a piece of driftwood. But anyway, so he's a senator from Virginia. Again, for some reason, she decided, oh, let's pick someone from Virginia because that'll get everybody excited. Oh, look, he speaks Spanish. Oh my God. Anyway, so the Democrats are unbearable, as I'm about to show you. Now, at the Federation of American Hospitals policy conference in Washington, D.C., Tim Kaine told the crowd, quote, I've got some concerns about it, meaning Medicare for all, meaning single payer. Chief among my concerns, he says, is with more than 100 million Americans getting health insurance through an employer-provided plan, and 80% of those are generally happy with their plan, I don't think they're going to feel good when we tell them, we're going to do a single-payer system, but don't worry, you'll like it just as much. For some reason, I just don't think they're going to believe us when we say that. See, look at that. We can't do single-payer because we don't think that people who are on employer-sponsored plans are going to like it. So, forget about the millions of people who don't have insurance, by the way, who cannot see a doctor, or the millions of people who do have insurance but still can't see a doctor because they can't afford the co-pays or deductibles. Now, forget those guys. No, we're just worried about the people that are working in the companies that actually have employer-sponsored insurance. We can't mess with them. Oh, do you realize that a Medicare for all insurance program would cover them as well? And that it would be better coverage for cheaper? Look, Medicare, as I mentioned, has an over 77% approval rating. There are people on Medicare or that are waiting for Medicare that can't wait to get on Medicare. Why? Because it works. Because it's popular. Nobody on Medicare says, I really wish I wasn't on Medicare, that I wish I could have a private plan. And look, with the way that Medicare works now, that there are many people on private supplement plans. Guess what? Bernie Sanders' plan would expand Medicare to cover the things that those private insurance plans currently cover, which means Medicare would cover, for example, vision and dental, things like that. Very, very important things, by the way. Dental is just as important to health as anything else. And vision, well, look, I have glasses. I'm going to speak for myself here, but I think vision is kind of important to have. So, yes, it makes sense that it would be involved in a expansion of Medicare, and that's what Bernie Sanders' plan actually covers. So, a lot of that covers more than what health insurance does. Because, again, a lot of health insurance plans on the private market don't cover vision and dental. So you would actually get a step up, and you wouldn't have to pay a premium. Instead, it would come out of your taxes, and actually it would end up being cheaper for you overall because of the lack of administrative costs, things like that. So, look, there are other benefits to Medicare for all. For example, look, the people who are tied into these and who like these employer-sponsored plans, well, what if they want to change a career? Well, you change your career, you're going to have to lose your health insurance. Nobody wants to do that. You no longer, under a Medicare for all system, you would no longer be tied to your job based on your health care benefits. Or if you lose your job, or if you become sick, and then lose your job from being sick, you wouldn't lose your health care. And look, as a bonus, it doesn't just help regular people who are working, it also helps employers. I mean, look, employers right now are right now, they offer and they shoulder a lot of the costs of employee-sponsored healthcare. Now, of course, they've increasingly tried to shift that cost off of their employees. And, well, that's not good. But, look, if we have a Medicare for all system, then the costs are shifted away from the corporations, away from the companies, away from the employers who do want to, offer employee-sponsored healthcare. It frees up their money to be able to, I don't know, invest in jobs or whatever, and do stock buybacks, whatever the hell they want to do. That actually will help their company. So this is good for companies too. Good for companies, good for employees, good for Americans. But let me tell you who they're not good for. Health insurance companies. Now, I'm not saying that health insurance companies should all immediately disappear. I think, there's a role. Elective procedures, for example, things like that you don't really need. But all basic healthcare should be covered by the government. And that's that Bernie Sanders model. Again, if you want to do cosmetic surgery, whatever, you love getting facelifts or whatever, or boob jobs, okay, let's have a private insurer cover that. But for everything else, things that are important to your health, it should be covered. And look, healthcare should be a right for everybody. Now, of course, look, Tim Kaine doesn't agree because his base isn't the voters. It's the health insurance companies. Medicare for all has over 50% approval. Nearly 2/3 of all Democrats support it. And yet, who do you think is Tim Kaine's base? Ain't the voters, health insurance companies. In fact, according to Open Secrets, Tim Kaine has taken $300,000 from the healthcare industry. And taken more from lobbyists. So, look, this is why he's fighting against Medicare for all. Now, you know what he wants to do instead? And of course, this is a classic establishment line. Let's improve Obamacare. Oh, okay. Well, he says, quote, I believe about any bill that you pass, a bill, and even if you say, this bill did significant good, you have to be analyzing it to see what it can be done better. So his entire plan is, hey, let's improve the failed market-based system, which despite some of its upsides, and look, I have friends that have been assisted by the ACA. There's been a lot of people that have been helped out by the ACA, and also the Medicaid expansion, which was inside the ACA as well. And all that's good stuff. And there was some forward momentum, right? And look, it was a step. It laid the groundwork, right? But at the end of the day, it is still a flawed for-profit model. And you can't fix that model. Because to fix it, again, to fix the problems inherent in this for-profit system, you would have to change it away from being a for-profit system. That's not what Tim Kaine plans to do. That's not what the establishment plans to do. They want to continue to tweak it here and there, but we're still going to allow these private corporations to make money because those private corporations pay lobbyists to go in and give us money as politicians. It's bribery, man. Now, Tim Kaine maybe have made some news earlier because the establishment, well, now they've just started coming around to the idea of a public option. Of course. A little late because that's what we were talking about at the very least back when President Obama was debating the ACA. We said, hey, look, if you're not going to go for Medicare for all, at least put in a public option and then maybe at least move us towards a Medicare for all system. No, that's not what they did. They completely threw that out. And now the Center for American Progress under Neera Tannen, they've come up with a plan. Like, we're going to call it Medicare X. We're going to put in a public option that you can buy into. You can kind of sort of buy into Medicare a little bit, but we're still not going to go to a single payer system. Now, of course, they call that amazing progress. That ain't progress, right? Because look, a public option would still be inside of that for-profit healthcare model. And that for-profit healthcare model, that is the problem in the first place. Now, the FHA president, Chip Kahn, told Kaine after his remarks that this organization was concerned Well, no, why would they be concerned? About lowered reimbursement rates under Medicare, and instead had urged lawmakers to work to fix Obamacare. Now, Kaine also said, "We signed on to Obamacare because we thought it was the best route to universal coverage. And if it hadn't been for the Supreme Court and Republicans, it would have been." No, it would not have been. Again, the way that President Obama and a lot of the Democrats operate is they'll pass a small amount of change, a little bit of a program that's, hey, it's decent, it's all right, it helps, and it's a little bit better, and we're going to call it historic change. And then we're going to wash our hands of it while we continue to enrich our donors. That's not the system that we need. That's not the system that we deserve. We actually deserve better. Look, the corporate Democrats, by the way, they're the ones who watered the ACA down and made sure it wasn't a public option or a single-payer system. They made sure that our healthcare system, the one that conservatives decry as socialism, actually turned out to be a Heritage Foundation think tank hatched plan, which is fundamentally flawed because it makes healthcare, which is a human right, unarguably a human right for all Americans, into a commodity that right now is truly only available to the wealthiest Americans. That is not how it should be. Look, Tim Kaine may have some concerns about single payer, but I think that we should all have a lot of concerns about Tim Kaine and his brand of corporate Democrat. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.